titled "Development and Validation of Knowledge of Caring for COVID-19 Tool." This study was conceived and carried out right here at the OCHS during one of the most extraordinary chapters in modern healthcare history. And of course, Oman was part of this. And before beginning, allow me to introduce our two distinguished guests. Dr. Saada Albarwani. She's the head of maternal child health nurse department.
I used to be. I haven't uploaded my CV.
Okay, that's what I've received at least.
Yeah, I didn't really.
Okay, she holds a PhD from the University of North Carolina at Chapel Hill. That was obtained in 2018. Her research focuses on breastfeeding pattern in Oman, nursing education, and clinical simulation. And she brings particular expertise in study instrument development and linguistic validation of research tools. The study we are discussing today is a wonderful example of that expertise in action, a tool developed, validated, and rooted right here in our Omani context. Dr. Saada, a very warm welcome from all the OCHS faculty, and we are so honored to have you as our first guest in the Research Café.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm honored and blessed to be the first person to present in this incredible, actually very smart way of presenting research. And thank you so much, Dr. Maimouna, for the introduction. I understand that probably you would wonder, the topic is COVID. Actually, we are not going to talk much about COVID today. We are dealing today with a process of validation and development of a tool. The reason I'm doing this, actually, I have a couple of more publications later on the same topics, a few, but they are in the pipeline of publication. They're not finished with the journals yet. So I thought I will present this method of validation and development. The reason I'm doing this is for one thing. First thing is I was asked by Dr. Saeed Rawahi to present. Second thing is to focus especially on validation and reliability of tools. Yeah, how you are going to develop a tool from scratch. I understand that from me working with multiple of people in our institution and outside, that validation is an issue. And a lot of this process is done by putting only the questions, the items together, without looking at the process and without looking at the major important thing in research, which is validation. And we all know validation involves the core of research. And if your research is not validated, meaning your tools are haphazard, then probably you are not going to have a proper outcome in your study. You are not going to be published actually in a major journal. Yeah. So let's start with that. So if you want to read about the article, more about the article, the content of the article are going to be sent to you by Dr. Maimouna or Dr. Saeed. And this is the article, you can look it up, and it's about validation and development of a tool. And here, what we're going to discuss is, I will briefly discuss the content of a publication, and then I will talk about the validity and reliability in relation to tool development. So, at the beginning, I would like to start that this tool, research tool, was developed based, this is the publication I'm going to talk about, but it was developed and based from a study that we had to conduct about behavior and intention of nursing students and allied health sciences during COVID, yeah, related to volunteering experience. Do they want to volunteer or they don't want to volunteer, and why they want to volunteer or why they do not want to volunteer? So that study is published in the Journal of Clinical Nursing, and you can look it up and see it. And it's a theory-rich based study. Okay. So the next thing is I'm not going to go through COVID, and we all know how devastating it was. Students were required to volunteer in this phase, especially the nursing student. However, many did not want to volunteer, yeah? And so we thought, okay, let's build a model based on a theory of planned behavior and carry out a study. We had to add knowledge of the disease process and the infection control is part of understanding the human behavior. So, of course, there was no specific validated tool regarding this. We saw some tools that were currently developed in that time, but they, according to us, what we wanted to do, understanding the behavior, they were none. So, of course, we need to understand the behavior of the students, obviously, because we are going to have them working, especially for volunteering reason for that time, all right? So the process was in a 5-phase process, and I'll go into more detail about this later, but this is just an outline. So we started with literature review, and then we went to the item development after the literature review, and then we went to something called content validity. I'll talk about a little bit, and then pilot testing, and then exploratory factor analysis. The study, when we have done it, it actually, the process of validation took us a while. About 6 months actually to really put the data together, the concept together. You might be able to do it in a 4-month period or 3-month period because of other commitments. We took about 6 months, but it was an intensive process. And we really wanted to do it in a very systematic way. Okay, so the validation process, okay? That I'm going to discuss a little bit in case some people who are joining are really not fully aware of what are we talking about. We're talking about validity and we're talking about reliability. So we're talking about validity. إيش يعني validity? It means your measurement, your tool, the thing that we're going to use to assess. Is it and it measure what you wanted to measure, or it measures something completely that that is not there, yeah? So we have 2 types that we are covering here. There are many type of validity that you can use. These are the most recommended one, okay? The first one is content validity. It's a must. It means your content, the one you put, is it adequate or not for the structure of your tool? The next one is the construct. Construct is basically your coherent factors. It means these factors or these subcategory explain specific items or specific concepts. And this is usually tested later on statistically by something called exploratory factor analysis. The next thing is reliability, and we talk about reliability, we talk about redundancy repeatedly. Are you measuring what you're supposed to measure? Meaning, if there is no random error that occur for measurement. Okay, so we are talking about internal consistency. We're talking about consistency of the measurement, and the measurement is free from any type of measurement error. And usually these concepts are measured statistically, okay? And so that is usually done at the end once you have the tool ready. Okay, the process was like this. So if you take a look at this, these are the phases. Can you see my cursor? Is my cursor visible? Yeah?
Yes.
Okay, so the phases is phase 1, phase 2, 3, 4, and 5, okay? So the phase 1 is here, the result is on this side. And then what is the measurement that we looked at in this particular phase? Okay, so let's start with the beginning, phase 1. The phase 1 was basically the literature review and looking at the knowledge during the pandemic, what we need to do to look at. And this we went to WHO and the other organization to go specifically look at this. Okay, whatever we didn't want to clash so much with the CDC and WHO, so we focused on WHO in that period. Okay, and we also looked at our regulation during that period, whatever we have about infection control. Okay, and phase 2, and this, we were able to extract relevant articles in this. And then from there, we set and we generated items, okay? And then we had about 23, okay? And then we had session phase 3, which I will talk a little bit more detail later. Phase 3, and this is the expert evaluation. We had our expert to look at the tool. And then from there, we decreased the item to 22. And then later we piloted. And then we had no change in numbers. We didn't delete much. And then at the end, we did the major study, which is the actual study. And here we determined the EFA that I said, exploratory factor analysis. And then we end up with 19. Okay, usually what we do is, whenever you develop a tool, you write a lot of items, and then those are going to be eliminated for redundancy, for mistakes, for not specific to what you want to measure. So the reliability at the beginning here, item generation, these two phases were item generation, and then we had content validity, and then reliability testing, the initial reliability testing. And then we had here the factoring or construct validity, and then the final reliability testing. So I'm going to move on. I'm not going to do this in more detail, but just in general. So phase 1, a literature review. Here we looked at the COVID literature, which was not much, but we had other literature about infection control and other tools that were there, and then we put them together, and what are the tools that were supposed to be mastered. In the outcome in this, we were able to have a blueprint of what to include in our tool. So we had 4 categories of items that we need to domains, we call them domains. We wanted to include them. And the first domain is transmission and prevention, clinical feature diagnosis, patient care management, and compliance and prognosis. Complication and prognosis, sorry. Okay, so we put the categories together and we decided these are the categories that we're going to use, and we started adding item to that. So this is very important to do that. Okay, so the item development here, we had the item format, and we said true or false. I don't know. That is, we thought it's very important to see don't know as an item. Okay, so we didn't really want to use the Likert test method of assessment here. Likert يعني من 1 ل 5, 1 to 5, agree or disagree. We did not feel appropriate to use that for knowledge. We thought knowledge, okay, either yes or no. You know it or you don't know it. If I don't know it, I write I don't know it. If I think I know it and I put it as false, then it's a problem, okay? So we have the 3 categories for the items to select from, the look of the format of the instrument, okay? So we did an initial pool. We actually did probably more than that. We went to, I think, up to 30. But then when we sat together as a team, we looked at the tool the item that we gathered. And there are a lot of like repetition, redundancy, doesn't make sense. So we ended up at the initial post, we ended up at 23 items. Yeah, this is more than what we wanted at the beginning. Okay, so and then we had our 4 categories to develop our tool based from, and that's what we did. Okay. The next phase we did CVI, and this is very important. We call content validity indexing, and this is what we look at the content. Is it valid or not? Adequately represent the knowledge of the construct that we are measuring. And then here is an expert judgment. إيش يعني expert judgment? Someone who's professional, who knows what they're talking about, who is experienced in that specific field. So what we had is, if you look at through the journal, we have inclusion and exclusion criteria. I will not go through that. And we determine who is going to be involved in the study. So we had nurses, we had specialized people who are working in infection control, any health expert who is dealing with infection and knows what is the chain of contamination and all that, and worked in that field. Okay, so the next thing we ask the expert to basically rate each item, and it was a kind of like a test from 1 to 4, and then each one will rate, okay, I agree with, or are relevant or not relevant, or how much relevant, and we have a column or comments of where you are going to explain and put more information of what you want to, how you want us to change. It was actually boring, tedious. Okay, we also put, but I haven't spoke about it here, a cultural relevancy of our tool. Okay, is it really asking these questions are relevant for Oman or not? But this is, I'm only asking about knowledge tool here. I'm only covering knowledge in this phase. So and then from after we got the rating, we had a calculation of ICVI, which is item content validity, and then there is a small calculation that you're going to do. You add up anyone who got 3 and 4, and we add it up, and then we have a value of 1 being perfect to 0. Yeah, anything above 0.7 or 0.78 is considered by Lynn. I have the reference here, 1986, as appropriate to be used. Yeah. So if anything that is lower than that, then we are not going to use it. We're going to drop the item, or we try to edit it if possible, if we think it's very important. Okay. So, and then after that, we're calculating the scale, content validity, meaning we have our 4 subscales, yeah, we said, and then each subscale, what is the content validity for that specific subscale. And we measured the targeted for 8 and above, yeah? And this is based on the literature. If you want to know detail about this, let me know. And I recommended at the end more like references for you to look at. Okay, so we revised based on that. Okay. So, and then we conducted the pilot testing, yeah? The pilot testing was on 43 participants. And these are, of course, we are talking about the Oman College of Nursing, Health Sciences, and any health sciences participant. I will not describe the sample here, and I will not describe the result of the sample. That's not the purpose of today. So we had the 43, and it was an online survey mode, cross-sectional, okay? And then what we did want to do in the pilot is basically a comprehension and understanding. People understand what we are writing, or we don't understand what we are writing, yeah? And then this is, we're talking about the participants. We already did the expert, and now we're doing the participant. So with that, we ran the preliminary or the beginning of testing. We looked at alpha, coefficient alpha here, Comberg alpha, and which is reliability, and we also looked at other things like EFA. We said exploratory factors. Okay, so once we have that, okay, in this phase, of course, we don't really delete much, okay? We only edit whatever we have. And then once we have it, we edit it, then we move to the next phase. We don't want to remove any item because the removal is going to be even if our reliability is low, because we're going to run it in a bigger population. And so once we are running it in bigger population, if it's very low, then we have to remove some items in order to make our tool stronger. Okay, in the phase 5, we did the factor analysis. Factor analysis is step-by-step, easy to do if you are using SPSS. I'm sure probably now by using AI, it's going to be much easier. So we use SPSS here, and what does factor analysis do? It basically uses all the tools that you have and putting it into clusters. إيش يعني clusters? Coherent and understanding of a specific item. These 3-4 items, they talk about this. So these 3 items, they talk about this. احنا جبنا 4 أشياء, لا? 4 things, okay? But here the factors were determined to be 3, okay? And then it told us what questions are related together, and the other factors are related together, or the questions are related together. And here we have a 3-factor solution, and we had 3 items that we had to reduce because they did not fall into any factors, yeah? And also because the reliability fell short. We'll talk about it now. So we did the reliability, which is internal consistency, okay? We spoke about it before, and we said is measuring consistency of the tool. Is it consistent throughout? Does it give us an understanding that it measure, if all the items are measuring the same thing consistently? Okay, so what we did, the item here, and to measure the major item, I told you we measured the beginning, but when we conducted the big study, the participants were 507. Those are the sample, and what we had is we had an alpha of the 3 factors. We had an excellent, very good factor of 8.3, and then we had a little bit lower, and then we had 3 factors. This was low, however, which was improved because we deleted items, yeah? Okay. So acceptable after deleting the items. This is okay, acceptable. Usually they tell you 0.7 is a standard of acceptance. Okay, so overall item we had 20, and then we had to remove because to increase the reliability of the items, and we ended up 0.76. Okay, and this is the guideline that you have for acceptable. All right. All right. So this is the end, the limitation. Of course, it contributed to the knowledge contribution of the study. We were able to develop a tool that is very practical, and actually, in a sense, we can really few edits we can do and implement it in any other type of relevant pandemic. Actually, we can use that and can use the tool. It's a very, very practical implication. Basically, we can benchmark and look at the knowledge of the people, benchmark training actually. Okay, they learned or they didn't learn. before and after. We can use it to build our curriculum and adapt it in any other communicable disease. Limitation, of course, the study was cross-sectional, the methodology. And then we used one institution, which is our institution only. We could have maybe used bigger sample in other institutions, although we had a big sample, yeah? Okay, the last, by not least, was the fun thing, which is naming the tool. So we had to call it something, and this is, we created an acronym, KCOVID, right? Anything else? Any question? And at the end, we have the references, if you want to look at. All these are reference related to specific. If you are only doing culture adaptation or adapting the tool from one language to another, the method are a little bit different. And that's it.
Thank you so much, Dr. Saada. It was really nice going through the journey of your research, although I'm sure it was much more complicated and you faced a lot of challenges through the journey, but you made it very simple for us, as if it was a piece of cake, which was not the case, I'm sure. So before we start receiving questions from the audience, I'd like to welcome Dr. Saada Rawahi, our expert today. And before that, please allow me to introduce Dr. Saeed. Although I know most of us, we already know him, but of course we should acknowledge some of his very well-known characters in the college. So Dr. Saada Albarwani holds a PhD from King's College London, where he also served as an affiliated researcher. His expertise spans health promotion, behavior challenge, and research methodology. And his work is published in leading international journals. Currently he's chairing the college research committee and supervises students and the committee members as well, as part of that. Most recently, he was awarded the National Strategic Research Fund and received an honorable mention in the International MAXQDA Research Grant of Healthcare, which is a recognition that places him among an elite global research community. Please, everybody welcome Dr. Saada Albarwani, and Dr. Saeed will be more than happy to listen to you and give us your feedback, or if you have any questions in regards to Dr. Saada's research.
Okay. Thank you so much, Dr. Maimouna, for your introduction. Dr. Saada, thank you so much for you, Saraha, presenting your article and the details of your article, and the way that you went, to be honest with you, through a rigorous process to develop a tool that can be useful in our culture. And to be honest with you, I'm very glad that you published, and I'm very glad also you share your experience in doing that within our culture. Because sometimes people might feel this process is a prolonging process, might not be useful, then they would immediately carry out the tools and utilize it without assessing its validity and reliability. And I think you went through the rigorous and systematic process by using the 5 phases of developing process of this tool: literature review, item generation, expert validity. That was a good Saraha, piloting the test and using factorability analysis. Others, they don't utilize it, but you have done it. And I think you base the ground of how we can start. Before applying the tools in the clinical, we have to validate it and move forward. And also, I personally believe the validity and ability, if it was kind of weak, you could redo the test again to improve it. So you identify the gap, and then you move forward and redo the test again until you make sure that your ability result it's at a higher level of acceptance. And also, one of the good things with you, Dr. Saada, you involve expert in content validity. 16 reviewers, that was not little, Salah. Usually others would do it in 2 or 3, خلاص, it's enough for us. We trust them and we move forward. But you have tried to involve as much as you can to make sure that the content validity is measured and also modification done to meet the requirement. Yes, Dr. Athamra? Is it?
Salam alaikum jami'an. Thank you so much for this interesting paper and congratulations.
دكتور.
تسمعني؟
ايوه سامع شو دكتور. انا ما كملت
ما انت قلت لي دكتورة ثمرة اعطيتني مجال ولا كيف؟ ما فهمت.
لا شفتي رفعت ايدك. يو ريز يور هاند.
اوكي سوري انا شفت قلت ثمرة قلت لي يس دخلت. سوري I'm out again. I'm out.
No problem. It's okay. Because the plan that we made is I give feedback and then we open the discussion صراحة, because it's very important. We learn from each other. And also one of the notable things that you made, you tried to create a tool that cultural relevance in our society, in our environment. I think that was very important. And in any culture or any tools, before you use it, when you try to develop it and design it within the culture, it will give more reliable and valid response, result that will really give impact in terms of policy design, in terms of changing any service. So I really acknowledge the way that you did it. Even indicating in terms of fact analysis or Cronbach alpha analysis, you have indicated there was some limitation of some factors or items, so you omit some of them to allow the increase of the validity of the tools itself. I would like to ask, also the good news, you have mentioned the limitation of your study, focusing one college. I think you have used a convenient sample. To me, it's a very good way to start with the convenient sample. But you could also go further than that if you would like to make it more generable and also, I would say, more valid, because we know that sampling method, it really influence the quality of research. Sometimes the researcher, because of the limitation of the time, because of the limitation resources, he will start with convenient sampling. But this doesn't mean that the article is not valid. No, people start this way to identify any gap, then they move forward. Similar with any validity of any study, RCT, sometimes you start with a small group and then you could start wider. I would like to ask you one more question, if you don't mind. What is your next plan for this particular study? Are you going to take it further than that? Expanding instead of focusing on the college, you go further than that and you modify the sampling method?
So let me first of all thank you so much for the nice comments that you provided. First of all, I would like to just tell you a little bit about the experience. If you decide to do these kind of things, I suggest that if you want to really learn it in a particular way, I suggest for you to run your results, your analysis yourself. Meaning, learn how to do this. This is very simple to do. It will take you like probably a week or so to really learn how to do this. I'm talking about SPSS, yeah? You have to do it yourself. And that's the only way you are going to understand so much of the numbering that are there. If you take a look at the tool, the article, if you take a look at the article, there are so many, let me see if I can find it here. So many numbers that are there. Yeah. A ton of numbers. Arqam. Because it's mainly like statistical.
Yeah.
Arqam, yeah. So I would advise you to learn how to do it and implement it yourself, and learn all the weird names that are given during the exploratory factor analysis. What the next thing is, of course, now we don't have COVID, but I really know that this tool can be adapted to simply, because we can just remove the word COVID and put the whatever pandemic or whatever infection disorder that is there. Okay, these are some of the questions that are there. Okay, so we're just removing the question and the COVID and putting fixing the question accordingly. Yeah, the next step of this, if anyone want to carry it over and to do a tool that is very very general to all the whatever kind of pandemic is there, then it's going to be confirmatory factor analysis that should be done in a different sample. And obviously not doing it in Oman College of Health Sciences. But this, doing the analysis myself and putting a paper, the paper for validity and reliability is a good way, basically, to help you with understand better. Not only understand better, okay, next time I'm doing this, I know how to do it better, or I know how to do it more accurately than this. In this paper, I use minimum, actually not minimum, a lot of validity, and I should have used a little bit more. Like many journals now have هذيك الأيام ما يدور عليهم, but they don't really ask you about so many. But right now you should also do things like test, retest, reliability. You're taking the test, one test, and then you're taking it the next time. So that kind of test you need to be done. Yeah, they want more extensive. And with that, أنا قريت هذا. شوف هذا. Let me show you this article. You see this citation here, the first citation.
Yeah.
So this is a systematic review and a systematic compiling. تعرفوا a systematic way of doing structured literature review. Systematic literature review. Yeah. This is a systematic way of also doing an item development. Yeah, but لما تشوف عليه هذا it's just overwhelming. Therefore take from it and apply it to whatever you want. But specifically, importantly, to put the concept in above them, and including test, retest, reliability.
Thank you so much. Okay, you really incited nicely. I think Dr. Maimouna, she will open the floor for others. Anyone would like to add something? Dr. Thamra, please.
Yeah, now I think it's time for everybody to ask questions and make it a real cafe, because this is not a lecture, it's a cafe after all. So please, you're most welcome to discuss whatever you want or add whatever you want. Dr. Thamra, I think you wanted to ask a question or something? Maybe she's away right now. Anybody else? Does anybody have a question?
Well, actually, Dr. Thamra want to discuss. So
yeah,
go ahead. And
yes, I'm here. I had a problem with my mouse.
Okay.
Hello, everyone. I'm so glad to be part of this cafe. Congratulations for Dr. Hasna and Dr. Saeed for having our first cafe for this semester. Doctora, congratulations for both, for all the authors of this wonderful paper. Not so many people would be interested to run factor analysis. I've done it so many times, and I know it's not a very pleasant thing to do. However, once you do it, you become so proud, and you become addicted, actually. You become very much sensitive into looking into tools. At least this is my personal experience, because now when I read articles, I actually look at the assessment tools differently. And you can only reach to this when you actually have the exposure to run the analysis yourself, as you mentioned. Now, having said what I said, Dr. Saada, have you looked into using McDonald's Omega?
Yes, I did, but not at that time when we did this one. يعني بالحين قاعدة أستخدم هذا.
Okay, what do you think about them? Because I'm a bit freak when it comes to McDonald's.
Yeah. What did you tell us a little bit about it then?
أنا واجد أحب ماكدونالدز الحين. الكورنباخ هذا بالنسبة لي it's a shift from old to new. So what are your thoughts about it?
Well, ما أعرف, because I haven't used it a lot. I only am using it in the current study اللي أنا قاعدة أسويه, and I'm still there. I think if you want to go ahead and give us more background, because that's not really my concentration right now. الحين أبدأ فيه أنا.
Okay, Doctor.
Go ahead.
Not that I want to say so much about it, but I just wanted to encourage whoever is doing any validation study to do both, actually, the Corenbach Alpha and the McDonald's Omega. McDonald's Omega is not within SPSS. You'll have to do lots of asking SPSS and the plugins to bring the McDonald's Omega into the SPSS. If you're using the old version, it becomes even difficult. But the McDonald's Omega is the routine internal reliability test if you're using R. The differences between the two is the assumption itself. The Corenbach Alpha assumes equal item contribution.
Yes.
But with McDonald's Omega, it does not. And here comes the superiority of using McDonald's. In most of the cases that I've witnessed both, there hasn't been much of discrepancy. But if there is any discrepancy, then you would want to go with the McDonald's Omega. No, I'm not saying that I know much. I'm still learning the process.
I am going to do the Omega.
Okay.
For my current study that we are doing. But that time هذا تقريبا 4 سنوات ورا I did not do it. Because I wanted to do the basic. But if you go يعني I totally understand. You're doing it along with CFA. You can do the Omega. And it will give you that. I'm talking about exploratory or confirmatory factor analysis. Yeah.
Yes.
If you're doing confirmatory, معناه إيش? But with that, you have to do a lot of يعني test. يعني مثلا if I have a sample of 500 participants, I can do the beginning 200, and then I can compare them with the next 200. We call it confirmatory factor analysis. Yeah.
Mm-hmm.
However, if you are going to do confirmatory factor analysis, and then it's advisable, you are doing it in a different sample, but you can still do it in half.
Inshallah.
لا في statistician هنا. Dr. Thamra, you are a statistician?
Yes, and my major is biostat, but for this McDonald's Omega, in fact, it's not a very old.
It's 1990s يعني تقريبا.
أيوة. It only became in fashion. It only became.
2 years ago. I know.
أيوة ما واجد popular. So
now it's in fashion. Actually, when I published the other one, it was in.
خلاص إن شاء الله نشتغل على good validation tool بعدين. We can use the Omega.
Yeah.
Thank you, Doctora. Thank you.
But usually when we're talking about Omega, you are going to do confirmatory factor analysis.
Yeah.
I did not do factor analysis, which is confirmatory. I did exploratory. You can do it with exploratory, but usually it comes with confirmatory. But يعني maybe I should have run it in exploratory as well. Thank you for that. I appreciate your comment.
Thank you.
أتفهم شيء يا جماعة؟
Thank you, Dr. Samra, for the feedback and your expertise, sharing your expertise in regards to biostatistics. Anybody else with any extra questions to Dr. Saada or even Dr. Saeed? Anything you want to add, Dr. Saada?
No. Well, I would like to hear more.
Ms. Zahra, Dr. Zahra, sorry, Dr. Zahra would like to answer.
خليت تكمل دكتورة سعادة. She was saying something. Continue.
لا ما عندي شيء. I would like to hear more from the faculty members who are teaching the who are in allied health sciences and nursing. يعني as a statistician, I'm sure she would pick up whatever the presentation and go beyond. But أنا أريد أعرف من البقية اللي في نفس مكاني أنا يعني.
So I think Dr. Zahra will be the best person to do that. تفضلي دكتورة.
Thank you very much. Nothing, wallahi. I want to thank all of you on behalf of Dr. Hasna, who's not here today. I want to thank the organizer, Dr. Saeed, the moderator, Dr. Maimouna, and the great speaker, Dr. Saada. As far as we love the convenience of having an online sessions, I would love to have it in person, face to face, so that I really understand the details. As a qualitative person, I'm a learner today for the quantitative, and we're learning. And as we all know, the research needs hands-on practice so that you can grasp the material. But today we learned about Dr. Saada's topic, Dr. Saada's tools, and the details that she shared today. I don't have specific question. I just wanted to comment and thank all of you. And I hope the rest have some questions to continue.
Thank you so much, Dr. Zahra, and thank you for uploading this very nice initiative from Dr. Hasna. I really wanted to hear her opinion on the first session, because this is the baby being born.
I can see the Dean Hasna is here. Oh,
yeah.
Yes, I'm proud.
Oh, she's here.
I would have missed this opportunity at all.
So we'd really like to hear
Greeting from Italy.
MashaAllah.
Thank you very much. No. Thank you very much, Dr. Saada, for being part of this cafe as our first OCHS researcher to present your research. And I actually wanted this project to reach out to the people, professionals in the service, to learn from our researchers and to intake the findings of this research to be implemented. So what we want is actually to have impact in the service of applying whatever findings from our researchers. Unfortunately, I was looking at the list of people who are attending today. Something not very many. I'm so glad we have this, and we have also Dr. Thamra with us, who probably can, spread the finding of this research to the people in the Ministry of Health or the faculties. And I'm sure also the faculties from the nursing program will be also sharing this with the colleagues in the hospitals. Thank you, Dr. Saada, for your
you're welcome.
Your research.
I'm happy that you...
And great. And I'm so glad that you gave us in light of the process of developing the tool. But my question now is, to what extent these tools can be implemented in the hospital with the real cases, and did it actually been implemented with your students, and is it there in the service now?
No, this is not.
I want to know more about that.
It's not a clinical tool, it's a research tool.
The research.
Yeah, to understand the knowledge. But you can implement something similar if you take it forward and take it to, but this is basically a research-based tool.
And you set some recommendations.
Yes.
Yes, and what I want to know is to what extent this to what extent this recommendation can be taken to the hospitals or in the future research.
Not the hospital, but we're talking about student-based. Yeah, these are in our curriculum, which we already implement. I think whoever is dealing with the first aid and سنة أولى معانا إحنا في التمريض, we are doing a lot of these things. Yeah.
Okay.
But we're talking about, if you're talking about staff implementing it in a hospital, the tool was basically for students, student-based and research-based. I'm not sure if anyone else would like to add to the comments.
So if I may say something else, adding to Dr. Hasna, I think Dr. Hasna meant what are the implications of your study? What impact this study would have within the environment, مثلا? Do you think it can be used in clinical education?
Okay. Now, Dr. Hasna, I think you're asking about research translation. Right now,
the students in the current curriculum.
Okay.
And to what extent this can be taken further?
I'm using it for our students, but the content is there, and then through the curriculum development, of course, the content is going to be there because we use the protocol, WHO, and all that. But what you're asking about is, يعني إني أنا أخذه, I implemented it. لا, I did not do that. But the thing is, لما نسأل عن what the question that you're asking, we're moving on to the next phase, which is what they call implementation research or implementation science. يعني, and this is lacking everywhere in the world, especially in our country. But when we're talking about implementing, we're usually talking about intervention research. You get it? Not implementing it.
Yes.
So
all right.
I had a correlation to understand what is happening. I did not have intervention to implement an issue. يعني لو كان عندي دواء, لو كان عندي sessions سويت حل community ولا شيء حل الطلبة. No, my study was not an implementation. Okay, so
all right. Okay, thank you for clarifying this. Thank you very much.
I think the translation or the implication, the impact of your study, it comes in a way that people need to validate their tools before applied. This is the most important things we can come out from your research study. And the other thing also, you could take next step forward. In the case of COVID-19, we don't have COVID-19 currently, but I think we could move forward. And the point that was highlighted by Dr. Thamra is a good point. However, the question will come back here: how widely used is McDonald's Omega? Okay, but you did respond nicely. I think you have to use confirmatory fact analysis with McDonald's Omega analysis as well. I would like also to appreciate Dr. Maimouna Salaha for her moderation. It was really laid out nicely.
Thank you for giving me this opportunity. I've learned a lot from this lecture by Dr. Saada. First thing I've learned from her, she's a very good presenter, and she's very passionate about the work she does. So I'm learning from you, Dr. Saada. Thanks a lot for that.
شكرا جزيلا.
Thank you so much, Dr. Hasna, for supporting us, attending from, mashallah, من Italy, mashallah. I hope you're enjoying your time. Yes,
Dr. Tamra.
Alhamdulillah.
In fact, I think people who have expertise in validation of assessment tools can actually, this is a suggestion to Dr. Hasna and the team over here. I think Dr. Saada going through this journey of learning about validating assessment tools could have a group of expertise, a group of people who could actually take this task of building capacities on this area. And the good thing about the expertise of validating assessment tools, most of the assessment tools comes from Western countries. And by itself, many of the papers that are related to validation are most of the times a good content for publication. I don't know who would be interested to do that. I am one of the people who are interested in running papers on validation and validating assessment tools. So I really encourage one of the outcomes of today's cafe, Cafe Without Coffee, Dr. Saeed, معلش, and is to actually develop a group who are interested in running and coming up with validating some of the commonly used tools, whether in the nursing or in any other programs in the college.
Can I add one thing, Doctor? I appreciate that comment. I think it's this aspect is really lacking in our research, and the purpose of doing research is not just to do research, is to be your outcome to be proper, not just implementing research or khalas. All right, so I think maybe having also sessions on how to do this, or maybe a course, a high-level course that is certified, and we can have people attending for a week or two, and give a certificate related to that. حتى charge people اللي برا. These kind of things I think are going to be very, very, very useful. And then if you're talking about developing of a tool يفتح مجالات كثيرة. في مثلا هذا التول اللي احنا سويناه, we published it in something called MAPI, an organization that usually it publishes too, and people are تروح تاخذ التول تشتريه منه, and that's one of the things that comes as validating. So we can put them in MAPI, other people can use them. However, all our staff can use them for free. We can sign a contract with them and decide on how we can use them.
Can I make a suggestion based on this raised by Dr. Tamra? I would like to make a suggestion, if possible. Let us create guidelines tools that can help people go through the process of how to validate such tools. So it's a guide, takes a journey from A to Z. Also, we can include what was suggested by Dr. Tamra, McDonald's Omega. Also, we can include it, because to me, it's the first time to hear it, to be honest with you, Dr. Tamra. And it's a learning process, as I said. You have shared a very good point, and it will help us if we can develop a guide at the college level. We can share with everyone, how to go through validity.
Doctor, already في organization that did systematic analysis and review وحطوا guidelines,
also including Dr. Thamra's suggestion using McDonald's. So what I was thinking, if nothing, we could integrate these. We could go through integration, including the tools that can be used and what is the purpose. Simplify it for the college purposes. What do you think? It's just a suggestion. if we can say no need, خلاص is no need. But I thought because you're not aware مثلا about McDonald's, you have not used it before. Or, يعني,
yeah, Doctor, يعني McDonald's is only for one thing, reliability.
I totally agree.
Validity.
I know.
يعني using it as part of and أصلا حتى لما if you run McDonald's عادة if you're doing compact alpha accuracy ما يطلع فرق واجد فيهم بالدرجة. But it's just confirming your alpha, yeah, your compact alpha. And I haven't used it in this study, okay, but inshallah this study اللي أنا أسويه الحين I know about it, yeah, because على 2016 و15 هذا الأوميجا طلع على 2000 على نهاية 1999 كذا 2000 2002 و3 و5 بدأ الناس يستخدموه. الحين بس اللي صار قوي يعني الناس مرة بدأوا يستخدموه خلال 3 سنوات 5 سنوات اللي ورا. So I did not use it because it wasn't really famous that time. It wasn't required by journals. But الحين if you're publishing a specific tool validation, then you probably want to put it together.
Dr. Samra?
Thank you very much, Dr. Saada. You absolutely nailed it. I think your response comes out of your expertise أيضا in doing things by your own, gives you a great opportunity to give this robust answer and responses. What are your views, Doctora, using AI in AI agents in factor analysis? Because I'm not talking particularly chatbots. I'm talking about AI analysis using well-established, accredited AI for statistical analysis. I don't want to promote any, but what are your views about this?
Wallahi, why not? If it's there, why don't you want to complicate your life? Whatever makes your life easy, do it. That's what I think. I think I think there are some of the qualitative tools, اللي موجودة softwares are using some type of level of AI, yeah, just for you to have the themes, yeah. I'm not sure Atlas has it. إيش هذاك الثاني زهرة؟ إيش اسمه؟ زهرة هنا.
Max QDA as well. Max QDA, they have.
Yes, I'm here. You're talking about what?
The tool that is uses Atlas وهذاك الثاني إيش اسمه؟
In vivo.
In vivo أيوة. In vivo بعد فيه some level of analysis that is using AI, yeah. However, I'm not sure بصراحة if SPSS حطوا فيه AI ولا لا لأن الحين ما شفت فيه. الفيرجن اللي عندي ما فيه.
في latest version.
But eventually, why not? Why not? If في tool جديد جاموفي أيوة. في I don't know if في AI ولا لا ما جالي استخدمته بس they think it's very easy to use. But why not? I'm sure eventually it will be there part of it. AI يعني إيش يحلل لك يقول لك لا ليش ما تشوف على كذا ليش ما تشوف على كذا. It's a very smart way of doing things. Yeah, I'm not saying خلي AI يكتب لك but ليش ما تخلي AI يساعدك في الاناليسيس. يعني you're not aware of all the literature about whatever is there. You're aware of whatever knowledge you have. It's getting having like 1,000 research who are top of their research helping you. I don't know. This is my perception of AI.
I think most of statistical tools nowadays they integrate with AI. SPSS, the latest one is integrating with AI. The tools, yes, the latest one is including AI.
Yeah, I should look
at qualitative analysis. My point when I raise to develop a guide tools for the college, it will bring all relevant literatures in one document, so we facilitate for staff rather than staff going and search. So that's why I suggested this, and we will look at it how we can implement it.
Doctor, having the process of validation, already there are literature regarding that. I mean, we can give a staff guideline on how doing it, but we're not giving them this is only way to do it, because there are many other ways of doing it. In addition, if we want to do it perfectly, then we'll overload the staff to the point that they're going to hate us. I mean, whatever I have the little bit above basic, but for my journal, if I want to publish this, I did not do مثلا test retest reliability. الآن I did not do Omega. I did not do so many other. I did not do confirmatory factor analysis. And to tell the people, this is what you need to do is not enough. Depending on what kind of research you're doing. Are you only doing? But then I don't believe in until you develop a new tool from the beginning. If there are existing tools, why should you waste your time and develop something new? I also wrote a paper about a process of implementing a tool. معناه إني أنا أخذته من بلاد برا، وهذا tool أخذته حالي and its behavior and beliefs وكذا. And I want to implement it in my population. Before implementing it, I make sure in implementing a proper tool. And that is a process of revalidation.
Yes.
And it's cultural adaptation. It's called cultural adaptation of the tool. Especially if you are going to translate the tool, there are specific ways of doing that. So there are multiple things to do in validation in the process of translation proper, validating proper.
So
that's the guideline.
I think the guidelines, if put it in the picture, is to guide, not to force or something else. I'm not saying I'm not suggesting it to force. People are vary in the way that they read the literatures. But if we're going to provide a guide, for example, as you mentioned, is the tools that you're going to develop, is it available? Is it valid? Is it culture reliable? So it will guide the person of how to move forward. Sometimes to facilitate things, it's a very useful tool. People sometimes might misunderstand, how to validate. So my suggestion was based on to facilitate things, put a range of things. It's a choice. If you use that will give you that. If you use that. So it's a guide that will really help the staff at the college to move forward with the validity and ability of the tools. هذا كان الأيديا. لأن أنت ممكن ما شاء الله عليكي you could go and read many literatures. Others ما عنده هذا الوسع، فهمتي؟ لكن أنت تخيلي all in one package أعطاكي. تفضلي أنت تبغي تستخدمي هذا الجايد النصائح. It's a advice, I would say.
Share a file here. Can I share a file?
Please share.
How? فايل يعني فولدر أعطيكم إياه أوديه حل الجمهور.
Folder maybe. What I suggest, if you could email it to us, be nice. I think because ما شاء الله يعني.
Let me just try to see if I can share I show you what I'm talking about. Hold on, let me just give me a minute. If I can access it. وش صاير في الإنترنت بطيء اليوم. Okay, you can go ahead and discuss and finish up the discussion or discuss until I'm able to pull this out.
What I suggest, Dr. Saada, send it to us through email. It would be nice because I think we had a good discussion. To be honest with you, we really enjoyed. Dr. Maimouna, the floor is to you now.
Yeah, I'm not sure whether we've come to the end of this because I think we're running out of time.
Yeah.
It has been a pleasure having you, Dr. Saada. Your research was really insightful, and a lot of people seem to be very interested in developing tools and validating tools as well. Thank you, Dr. Thamra, for your very insightful feedback and your suggestions. Everybody's suggestions were noted down, and all of these will be passed to the committee. And of course, if anything can be done, any benefits out of this very nice gathering, of course, that will be done بإذن الله تعالى. Thank you, Dr. Saeed. Thank you, Dr. Zayana, Dr. Zahra, and whoever is there, Hamid, Dr. Leila. We haven't heard from you, but I know you're there. Thank you, everybody. And please, if anybody has any questions, I think Dr. Saada will be more than happy to receive emails or even meet people face to face, because she's
Dr. Samra is there. She's probably better aware of these methods.
Yeah, of course, Dr. Thamra, of course, she's always there for everybody.
We'll invite her, inshallah. Inshallah, she will be invited.
No, Anna, please don't feel that I'm interrupting anything. It's just
no, بالعكس دكتورة يعني.
I really congratulate you, يعني honestly.
No, I think you should.
واجد حبيت your.
المفروض نعرف أنت وين جالسة عشان نجيلك.
إذا جيت بتندمي لأنه بحط لك واجد شغل.
سمرة، هل أنت statistician من الكلية ولا
والله أنا ما statistician. I'm an MD. I'm a دكتورة physician.
yeah. I know, but
أكمل لك التايتل مالي البورينج.
I
am a master holder. I majored in biostatistics and maternal child health in Massachusetts, USA, and then عندي PhD public health, which I did 3 projects: randomized control study, factor analysis, validation tools. وتعرف البريطانيين when they squeeze you to do right things. So I learned all of this the hard way. It wasn't easy. So I totally relate to what you are presenting. هذا vocabulary is not easy. I'm sure out of the people here listening to you, it might even sound Chinese to them. يعني it's not easy at all. That's why I want to repeat again, probably we should create more voices for factor analysis and validating tools. Enough from my side, but congratulations, Doctora. I love what you do. Keep on the good job.
Inshallah, we'll invite you, Dr. Samra.
I appreciate actually what your comments very much actually. And I really أنا عادة لما أسوي presentation لما أعرف إنه في هناك statistician ولا someone who knows biostatistics أنا أبدأ أخاف عشان أصلها تكون صعبة.
والله I'll tell you one thing, Saada. If you want to produce good papers, زين, and especially in the area of validating tools, you will naturally grasp lots of statistical expertise.
Yeah.
أنت by now you are above average.
I appreciate. والله I appreciate.
You are already a statistician حال الكلية.
وين مسكينة أنا. But I really appreciate all the comments that you provided. والله.
These are the hidden talents of Dr. Saada.
Thank you.
He has a lot of talents.
More to be listed, mashallah.
Dana.
Dr. Samra, you're so sweet, and I love the way you express حقيقة and يعني you're ايش اقول
زهرة وريني شكلش لأن أنا أنسى ما I can't
دكتور
do
ثمرة
names وfaces.
جرحتيني
دكتور ثمرة
شكرا
هذه طالبتي my student.
شكرا
very much for the whole
خبريهم
ما انت وبعدين دكتورة
الحين خبريهم ان عندك طالبتي
هي تخاف من دكتور سعيد.
لا no, once upon a time I was
thank you. It's a cafe. It's supposed to be free with lots of coffee, lots of
free coffee vouchers, at least something.
يلا مرة دكتورة حسن لما ترجع من إيطاليا بتعزمنا.
يس حميد تفضل حميد. تفضل حميد.
He's just asking whether he should stop the live streaming ولا لا.
Yes.
مال اليوتيوب يا.
I can see.
الحمد لله. وقف خلاص.
أتوقع يكفي.
هذا برايفت.
زيانة تفضل زيانة.